Welcome to Africa in Harlem, live from the village of Harlem. I'm Issa. On April 8th, the city and state released data showing that Black and Brown New Yorkers were heavily impacted by the coronavirus. Here in New York City, Black and Brown New Yorkers account for 69% of COVID-19 deaths. So we wanted to know how the African immigrant community was doing. We spoke to a few leaders, and this is what they had to say.
The Senegalese community, like any community in New York City, we are very, very, very scared for this coronavirus that everybody knows what's going on at this time. But the best thing we are doing right now is to mobilize our people, to educate them, to inform them what's going on about this coronavirus, to tell them what is the things to do to avoid or to reduce that coronavirus who contaminated people all over the world, specifically in New York City. The Senegalese people here, we join our energy, we join our idea, our force to help each other, to help the neighborhood, the friends, the people who will live together, and try to fight against this coronavirus. It's not easy because so far we having some people who pass away because of the coronavirus. That's very sad. That's a very sad news. And we keeping having people getting the coronavirus laid down to the hospitals, to their house. Just today, we have one of our fellow folk pass away in the Bronx. Maybe later I'm gonna come to the details. But to tell you, to answer your question about how we're doing, we're trying to do our best. It's not easy, like any community in the city, trying to help each other, to inform, to educate that coronavirus, what is the cause of that, how it's gonna contaminate people, and we trying our best to avoid the coronavirus. But it's very tough. It's very difficult at this time, Isa.
Mm-hmm. Have you recorded any death in the Senegalese community?
Yeah, so far we record 10 of them, but I cannot say that all those people has been contaminated by the coronavirus. But for sure, we have 3 or 4 people. That's the coronavirus who attack them and they pass away.
Mm-hmm. So, do you know what these people, what kind of job they had, and how they got into contact with the virus?
Most of them, they are tax drivers. And 2 of them, they are people who selling on the street, people who doing the small business like selling the bags or selling the sunglasses. How they doing in the
street
city.
Vendors.
Yes, the street vendor, exactly. They're doing their small business. Most of them, these are the people who had been killed by the coronavirus.
Can you tell us what are the issues that you're facing right now?
Yeah, the issue we're facing now is the sickness. This is not something we need to be quiet. We have to speak out because at this time we have one of our people who's at Mount Sinai Hospital who lay down there because of coronavirus, but he's under treatment. He's under treatment. That's happened today, and somebody passed away in this morning. Okay, he's in the funeral home. But the main issue we're facing is they don't want to tell us they do have the coronavirus.
Mm-hmm. Why do you think they are hiding?
I think they're hiding because of when they say in Wolof, this is a bala, this is a musiba. For them, this thing is attacking people who, I don't know, who doesn't do right thing. Exactly. That's a religious thing. They think that's why they're getting punished from Allah, punished from God, whoever you're going to call it. That's why they try to hide in that. But for me, that's not the reason why. Mm-hmm. If you hide it, it's going to contaminate the community and it's going to be worse and worse and worse in the future.
Mm-hmm. So how are family members dealing with these deaths? And you, as the association, are you able to manage it?
Yes, we're trying to best, me and the consulate and the general consulate, and as now we're trying to manage those family members. That's why we put in place a panel we call it ASA COVID-19 to inform, to everybody join. We're trying to do a fundraising because for that money to help those people who has been victim of the coronavirus. So far, we're raising little money on that, and that money is going to help those people financially. If their father or their mom pass away, they have kids, they have a lot of expenses. We think that money can help a little bit.
Do you have any problems with maybe finding the money to bury people, or no, not in the
Technically, not really, because everybody understanding at this time, at this moment, the main thing, the best thing to do is to bury people to New Jersey. We cannot try to send the body to Senegal. First of all, there is no flight. Second of all, the government of Senegal just say that whoever had been contaminated or passed away because of the coronavirus is not allowed to send it to back home, because they're scared to contaminate the community over there. But if you pass away because of something else, we're gonna try to send the body home.
Mm-hmm. Mm-hmm.
But technically, we have problem to keep those people in the funeral home because there is no place. The city has a lot of deaths.
Mm-hmm.
The first thing we're gonna do is, if somebody pass away, quickly we're gonna take him to New Jersey to bury him. Unfortunately, that's no belong to our culture, our religion, our education. But because of this moment, of this context, we have to do it. We have no choice.
Do you have problem knowing the cause of death?
When somebody pass away, if you ask them if this is of the coronavirus, we don't know. We don't know. We don't think so. And technically, here in New York City, most of the funeral home, the doctors, they assume that whoever today passed away is a coronavirus. And family members, they want to get an autopsy to see the death of certificate, the reason why their family member passed away. But this thing gonna take time. We do not have a doctor or somebody who available to do that autopsy right away. It's gonna take time. It's gonna take maybe 4 to 6 weeks. And unfortunately, we cannot keep those bodies in the funeral home because there's no place. We do have problem because they don't want to tell us exactly what's going on. Like I mentioned before, they don't want to tell exactly that is the coronavirus kill their family members or their friends. I don't know why.
What would you need from the city to be able to better manage this crisis?
The Senegalese community, they need to cooperate. They need to understand this is the context actually. It's not because of you or me or someone else. They need to understand and tell the truth to the city that the city can help us. If somebody passes away, if you don't want to say this is a coronavirus, you hiding. I doubt how the city is going to help us. We have to tell the city the truth. We have the coronavirus in our community. People passing away. We're having death because of that. I think once the city get that information, they will know they're going to be very dedicated, have an engagement to help us. But if we keep it hiding, it's going to be very hard to city to help us. But we still need the city to help us. Why? Because I think there's a communication. Now we need to communicate. I don't think the city at this time can help a lot because they are very, very overwhelmed. They are very busy. I know how many people pass away every minute, every second. So the city is very busy. I think we need to help the city to assist them, to inform, to tell them the truth. And by the way, they will be able to help us too.
How is the community doing with everybody staying home? What about the children? What about earning money? Are people able to file for unemployment? Are they able to file for these loans? How is it going in the community?
Yeah, they get the information. We gave them the link as the association, how to find the unemployment. And also we tell them if you have a small business, there is a fund available, there is a loan, but you have to do the application. But most of us, they don't know how to manipulate the computers, how to do the things to the internet. But at this time, our community center is closed because of the coronavirus. It's very hard for us to help them. But we do tell them if they need help to contact me or contact some people who are available to get their information and to apply for them to get the unemployment, to get the loan, to get the fund from the city. But they stay home. Children are very tired. They don't know why they stay home. They used to go out every day. They are little. They don't understand how things go. family are very scary. Most of them, they are taxi drivers. They are business sell on the street. They cannot have a check at this time. The money is not here. The food is finished. It's very tough, Ether. I think they need help.
At this time, my community is hearing is having a big problem. We have more people who are dying. Yesterday, we buried three people, and today we have another two in the funeral home. So far, we have about 11 people who passed away.
You said you have about 11 people who already died.
Yes.
When did you record the first death in the Guinean community during this crisis? Do you remember?
Yes, we have it with one of our brother who named Mr. Amadou Nyan, who was sick from the hospital, and I think one of his family was in quarantine, wife and son is in quarantine, and this is when he passed away. The news was spreading out in the community, saying that the cause of his death was coronavirus.
Do you know the other Guineans that passed away? Do you have an idea of what type of jobs they were doing?
Yes, most of them are doing a liberal job, like the driver.
Taxi driver?
Yeah, less paying job. Most of them, but Mr. Amadou was someone who is helping the community how to integrate in the United States. This is the job that was very highly educated, and he knows he knew how to prevent himself from whatever.
The Guinean community have been one of the West African countries residing in the United States, mainly in New York City, that have been affected by the coronavirus. Mr. Maka and I have been on the graveyard at the cemeteries on several locations for the past 2 or 3 weeks. Exactly what he said is the death certificate that we receive from the hospital that are signed by the doctors. Few of them, they don't usually say it is COVID-19 on the death certificate. They're going to tell you the cause of death, like Mr. Nyan, they discuss about high blood pressure and other cases where they talk about pneumonia and having breathing problem. So this is the majority of it. There is also another older lady who was like, the cause of death was lack of eating, complete cut off through from appetite. So as you listen to the news, you see the COVID-19 can attack older people that already have preconditional health in a different format. Now, what we are doing right now, I can tell you, is we are struggling. Bronx, Lebanon, where we have one of the bodies for like 6 days for to get the body.
6
It was
days?
really
Why
terrible.
so long?
Well, the doctor have to sign the death certificate online. Once they sign it online, the funeral home get access, because once we got information that a family member has passed away, we immediately contact the funeral home, which will usually go and pick up the body. Now they have to wait online based on the information we give the funeral home. They will match with the information they got from the doctor to identify the body. So once the doctor signed the death certificate, that gives them the authority now to pick up the body. Now, the New York City Department of Health have instituted a new law which require all funeral homes to call in from 10 a.m. to 2 p.m. to make advance notice for 24 hours before picking up a particular dead body. Now, once the New York Department of Health does not sign the burial permit, that does not give the funeral home the authority even to contact the cemetery to do the burial. So it's really, really complicated. Now, the most sorrowful part of the issue that one of our brother who passed away very, very close to my to the mosque here, into my office, he passed away at home. Most car drivers, they all park their cars, they're not working. But you understand, as a family, sometimes you need to get out to get some food to bring back to the house. I know the family who've been affected and they are recovering. They stay home, they stay in touch with the doctor, and they keep following instructions, what they need to do, because no need for you to go to the hospital, except if you cannot breathe. There's certain way that you can stay home and do some exercises following doctor's instruction that usually help. We are doing Facebook Live. We got doctors in the community who are working in different hospitals that are doing videos. We are sharing those videos.
How are the families coping with this death?
As a leader, what I'm seeing here, the government system is now working very well at this moment, at this time, for the coronavirus. What I'm trying to say here, when we have someone who passed away at home or at hospital, the late of delivering the medical exam put many family in a danger, because you don't know the cause of the death. If this person who passed away, the death was caused by coronavirus or another thing. Now, culturally, we used to go, as Mr. Nebi said, say hi, the compassion for the family who the member. But now we're not doing that. But still, the close family, when someone passed away, like this guy last time who passed away on Sunday, his wife is there. His close parent family are there.
If I understand what you're saying correctly, the Guinean community is not receiving quick enough the reason of the death, so they can let family members know, or members of the community, so if need be, they can quarantine themselves. Is it what you're saying, Mama?
Exactly. This is what I'm saying. The Guinean community is the community. All people who pass away, this is what we realize, the lateness of delivering the certificate of death.
So do you think that among the members of the Guinean community who are dying, are those tests done to see if they died of COVID or not?
Well, that depends on the hospital, and also depends on the arrival of that individual at the hospital. How busy the attendants at the hospital at that time. You understand? Most of the cause of death are mentioned, as I told you: pneumonia, high blood pressure. You understand? Lack of breathing. The chest, the lung are congested. They can no longer breathe. The moment they get to the hospital, they're not allowing any family member to go in. So I can testify to 3 or 4 deaths. Once they take them to the hospital, no family member is allowed to get in. You only get in through phone contact. And sometimes it's really very, very difficult for you to get a proper answer until they call it, say, okay, your family member passed. You understand? And the other time they will know the cause.
It's very sad that, I mean, because
it's
as members of the community, you want to be there when your family member is in the hospital. But if you're not able to be at the hospital because you cannot have access, and then the person passes away, it's a problem.
Like say the first week, there was some access, but now it's no access at all. Mr. Maka can add some.
Okay, Mr. Mamadou, do you want to add something?
Oh, yes, he already started topic. This is very important topic. We're saying that for this death certificate, Now, since the hospital are overwhelmed, it's taking more than 3 to 4 days or 5 days to get to the depth of the certificate and the certificate of burial. This is causing too much problem to the family and the community. We having a big problem for that. Before, when someone pass away, in 2 days you can schedule the burial time. You go to do it, but for now, it's about 6 days to get this depth of certificate and the burial. We having a big problem for that, and having a problem also how to collect money to for the funeral home services, 4,000 something dollars for one person, and for the community are or the place where we used to get together, like the masjid or other places, like the churches are closed. This is what we are doing it through over the phone. We having a big problem to collect all the money to to do the burial. We having a big problem for that. But for now, for the prevention, we as a community, we when something happen, now we buying a mask, glove, hand sanitizer, bring it to the family, the family who lost their loved one. In case of someone, because of his relation comes there, he will take, if he doesn't have the mask or glove or hand sanitizer, he will use it once he get there or come back, or even to the burial, the cemetery. We are having it now. Like yesterday, we have many glove, mask, and sanitizer to those people, few people, like less than 10 people to attend for the burial. You want to make sure the glove that they're using for the burial, they will put it in the garbage. You take it when once they are inside the car. You don't want to take the virus from this 5 minutes, 10 minutes for the burial and bring it to the car, and you driving, you think you are by yourself, you not spread it, because you can easily take it to your home. We are telling them also, when you come back, take off your clothes, take all your clothes, put it in the plastic, whatever, and go directly to the bathroom, take shower, hot shower, everything before you come to the living room, say hi to everyone.
What can be done to make things easier for the Guinean community?
I can say it's not only the Guinean community alone. I believe this is a problem faced by everybody that lives in the city. The difference is that the Guinean community has been overwhelmed with too many deaths. That is more than many other African countries that reside here. The reason why is because we are open. We make sure when there is a death, we use this social media platform to inform our community. The other point that we are really had, that the president mentioned here, is the cost of burial. Before the coronavirus, the month we spend here to bury an individual is $3,000. That includes the 1,500 for the cemetery, opening and closing, and 1,500 for the funeral home. Now, the last three people buried yesterday, cost $4,300, $2,000 for opening and closing, and the funeral home $2,300.
Is it legal though? So it seems like they raised the price during this crisis?
No, this is what happened. The cost of the funeral home have not been equal from the time we've been dealing with them. Some of the funeral home, we have contract with them for quite a long time. Those are overwhelmed. Their prices. And now the graveyard where we buy the grave, organization and communities go out there and buy grave. And now, if they buy the grave for this amount, they have to live with the people who manage the cemetery, who does the opening and closing. Their prices are different. Now, when we come out there now, once the cemetery doesn't have any grave for themselves, now they have to buy it from another organization. That means they have to make something. That's the cost.
So
Because it just
they reselling graves right now? Is it what you're saying?
yes, exactly.
Yes,
Because
yes.
the Mohammed Jallo, the first guy who passed in NYU in New York hospital, actually he was not coronavirus at all. He got he fell down, and you know, because of the blood going over his head, that was the cause of death. His grave cost us $1,600, and now grave is costing us $2,000, because when they buy it from another person, they add in $400 or $300.
Wow.
So that's what happened. Yeah. So it's really, really difficult now.
Okay.
And yeah, and also why the price is raising up. The other cemetery, some people are losing their job there, and saying that they don't want to expose themselves at this time. They quit. That's number one.
Okay.
Number two, also in the funeral home, the drivers who used to go to pick up bodies, the last time when I called for this person, Elaza Yaya Ba, the driver told me, if I have to take your body, he will be the 21 person. I already have 20 people here, 20 bodies here to bury. If I have to take him, he will be 21. Now, as Mr. Jallo said, the place that they used to have in the cemetery, those places are they finished because all the Muslim or other people are going there. Now they have to buy it from other people, from other people who used to have because the price is going up because the drivers now continuing to go to expose themselves, because when the driver has the body, 2 or 3 body from Brooklyn or from Queens to the burial in New Jersey, he's staying there with this body for 2 hours or 1 hour. And they consider themselves, they are exposing themselves because of this body, either from coronavirus or not. Now, if the cemetery used to, the funeral home used to have 5 drivers, if 2 or 3 of them quit, now it will be only 2. And these 2 people, they taking their risk. They have to, the management will have to say, okay, since the other people go, I'm going to give you, instead of paying you 1 hour, $35 or $40. Now I'm going to pay you $80 for an hour. Go pick up this. This is where the prices are raising up.
Are members of the community, did they file for unemployment? Have they filed for all these? Are they aware of all these loans that are available to businesses that are affected by COVID-19?
The information as how the government are providing assistance is well known to the community. Let me come to the unemployment. The unemployment is where we have issue with the state of New York website always overwhelmed. Once, for a self-employed person is the most difficult part when you are self-employed. You have so many questions. And the second thing that makes it much more difficult, you have to create an online ID. No matter what, and many people do not know how to create this online ID for themselves. They have to go to someone else. And it is time consuming to create an online ID and use that online ID with verification from your previous taxes or information from the State Department of Taxation before it's sent you now to Department of Labor that handle the unemployment. Now for self-employment, they will ask you a bunch of questions. For many of us that do this application for people where the person don't even remember, that's going to become a problem of somebody did. You know, they ask you so many dates that, you know, they range from one area to another. When that is said and done, now they will require you to make a phone call to the Department of Labor in order to confirm that you are eligible for this benefit or not. So it is really difficult. The other part that for businesses, they go through your banks. I can say, maybe for the one thing here, I can, allow Bank of America here because I've been doing application for business owner. As long you have an account from Bank of America before February 15, that the account was open, you are eligible to apply for the SBA loan, which is the paycheck. You use through your bank, which is much more faster. You submit the application, you go through to Treasury Department, SBA. Now, another last example. When you talk about other banks, once they tell you, oh, we are overwhelmed. Now, for you to go through the Treasury Department, their application is merely made for banks that are going to require funding for their customers. Wells Fargo, I tried to do an application for a client of mine. We took 2 hours to get through customer service in order to get the website. Once we got the website, oh, we are out of luck. We took more application now because of shortage of staff. We are handling this application until further notice. He cannot make that application through his bank. Now he has to wait for us to figure out a way for us to do it directly through the Treasury Department. And the other option, there are other people who have not been filing taxes, or they are under, they are under reporting, they are underpaid. If you don't file taxes for 2019 and 2018, or you do not have a direct deposit, because many self-employed cab drivers or people who self-employed, they end up paying the government. They do not get money back. So the government do not have their direct deposit account, because all you do, you pay the government. So what they usually do, they buy money order, to make their payment. So those are some of the issues that the community is facing, and we're also looking out to find ways how to address this question. I got million calls for this question. All the calls that you see to this interview are client calling, asking me, I need to do this, I need to do. It's really, really difficult for us right now. Mr. Maka knows it. As a community leader, you are volunteering, doing all of this unpaid. At the same time, you have to handle your family, handle your business, and handle the community. So we pray that this epidemic will go away forever.
What would you want the city to do for the Guinean community right now to help with this crisis?
Number one, we wanted to get access to the death of certificate and the certificate of burial as soon as possible. It's happening. That's number one. The number two, we want to have a financial assistance, because at this time we are confined at home. We're not working. When something happens, we have to go outside, try to collect money left and right through the bank or jail, how to bury those people. If you take like 4,000 and something to bury someone, and we have 11,000, it's about $45,000. And where to get that money? We used to go to the masjid, ask a donation, and now we're not having it. And most of the time, the family who get lost their loved one are the one who also give him 50%, 70% to the burial prices plus the community. We're having a big problem for that.
Our community concern is the resource, and also the health problem, because many of the African people, they don't have insurance, and they're scared in case, they have this, how they can be treated, That's our main concern, because many people like immigrants, so they don't have a insurance coverage. And also the resource, so to buy food, they have kids, but the food they give at the school, so it's not enough for the children, it's not enough, to tell you the truth. So the family, they are suffering, they suffer, suffering. So they really need help. They really need help, to cover those expenses. in order to buy food, to stock food, don't go out. You need a lot of money to go to the supermarket to make like a 1 month for, you know.
Every New Yorker who needs to see a doctor because of coronavirus, they should not worry about their status, their immigration status, or their ability to pay.
I knew, but you know, people don't trust those kind of talk. You know, like even this for the census, they say it doesn't matter even you are immigrant. It doesn't matter with your status. You know,
The immigration status.
Still, people are scared, and people will think the mayor said that, but it doesn't mean it will be like that. Even the mayor said, but if they sick and they go to the hospital, maybe they those people they don't have no insurance, so let's treat the people who have the insurance. So you know, it's very difficult to make people understand it's free and they don't have to worry. Even you tell them, but they won't believe it. That's the problem.
The mayor announced yesterday that the schools will not reopen until at least September. So how are families dealing with that new information?
It will be a long time to be with the kid in the house. So
yeah.
So this is gonna be very difficult, but we are creating some program, you know, to make it easier for the children and their family.
The main issue is healthcare, and the second is resources. You seem to say that the food that the city is distributing through the schools is not enough to feed the families, that they need additional support.
I would like the city to help everybody, you know, financially, no matter of your immigration status, to help you with some extra money, because nobody has money now, and people need to buy food to start at home so you don't go out, you know, because this coronavirus, the best way to avoid is to stay home. But if you don't have money, tomorrow you have $20, you go, you buy, you come, it's finished. Next day you have 40, you go, you buy, and it keep you going out. And this risk is high, you know. So if you have money, like you have like 200, 300, you go straight, you buy everything and you start. So you have 1 more month, you don't go out. And that will be safe for the city, and it will be safe for everybody. Food from the school, that's the African people, you know, we are not used to those food from the school, you know. So it's better for us to go to buy our food and make our own food. And I think this is something to help people and to stop, spread the virus, you know.
I think we've been hit pretty hard. I think as of last count yesterday, I know there's about 14 people, within the Ghanaian community. And that's just the Christian community. The Muslim community, we have about 5 as of yesterday. And out of those, I know personally about 60% of those people that have passed.
We know that the Bronx has the largest African immigrant population. So how is the larger community dealing with the crisis?
You know, one of the things about the African culture is being able to commiserate with one another when tragedy happens, right? So it's part of us, it's who we are. And the fact that you can commiserate with your fellow African when a tragedy happens, the fact that you can have a decent burial for your loved one, I think it's really affected the community very, very much, yeah.
You said that, you know, maybe 60% of the people
Right.
who passed away in the Ghanaian community. Do you know how they contracted the virus? Maybe what type of jobs they?
One of them I know for sure was a nurse at Jacobi Hospital.
Oh.
She most likely contracted it in the hospital taking care of COVID-19 patients. Um, some of them had underlying issues, that diabetes, the blood pressure, and those things. And so they, and one of the things that experts have been telling us about this disease is that when you have a compromised immune system, the virus can easily attack you, and your chances of fighting it becomes a little bit difficult. And so I believe those are some of the issues. And also, I think early in the beginning of this whole
Crisis.
virus crisis, a lot of our communities didn't take it seriously. To be honest, some of the churches were still, operating. Some of the mosques were still operating, and so I believe that's where some of these people contracted the virus. Another thing also is that a lot of our people were not practicing this. They say social distancing, but I'd rather call it physical distancing, because we can still socialize, but at a distance. You see, so I think one of the issues is that a lot of our communities, when somebody is sick, we have a tendency to want to go visit the person. Even though the law, the governments, everybody has said that stay home, stay home, stay home. Some of us, we still have that African tendencies, right? So we want to go and visit the person, sit with the person, and I believe that's how they probably contracted the disease.
Mm-hmm. The mayor announced that the schools will be reopening most likely in September. How do you think African families are dealing with that news, and how will they handle the children during that time?
This problem is not unique to the African community. I think one of our biggest issues is the language access, and that is something that we're trying to push to make sure that while these children are sitting at home, we want to make sure that whatever instructions they were getting in school, that they still maintain those instructions, even for some of our newly arrived children who are into the bilingual classes. We were trying to make sure that they get those bilingual resources that they need to be able to continue their education. As far as dealing with the children at home, there are resources out there that's telling the families how to deal. Come up with creative ways. Play some games with your children. Get to know your children a little. This is an opportunity. It's a tragedy, but it's also an opportunity for parents to get to know their children and the children to get to know their families. I think, Isu, that within our communities, a lot of times all we care about is making the dollars, right? Just go out, get up in the morning, go to work. Once you drop the kids off to school, you're just working. You come home, you barely have enough time to even check the kids' homework. You pray, you take shower, you sleep, you repeat the process every day. And so this is an opportunity, I think, for parents to get to know their children and the children to get to know their parents. So let's take advantage of that. And there are resources. I think there's a lot of, the city is providing some resources on creative ways of dealing with your children while you're at home. And not only your children, but in some cases, your spouses.
We know that the African immigrant community is the most educated immigrant group in the US, but we also know that we have illiterate. They're probably having difficulties homeschooling their children. So how are they dealing with that?
I think that's one of the issues that I mentioned earlier is the resources, right? We know the city is providing tablets for all the children. In some cases, some of our families don't even know this. And so we are trying to come up with ways of reaching out to these families.
What are maybe some of the other issues that maybe you didn't get a chance to raise before I let you go?
The biggest problem right now in our community is information and education, knowing where the resources are,
and going after those resources. Isu, I mean, you'll be surprised. In the last few days, I've been getting so many phone calls about families asking, where can I get food? How can I pay my rent? So one of the things that we're trying to do is to come up with a way of relaying some of this information to these families. In some cases, we help them ourselves. Like I've done unemployment insurance applications for about 7 people since I've been home right now. And so, those are the ways that we try to help as much as possible. And so right now, what we're looking from the city is to make sure that whatever information comes out, that it comes out in a way that's really that's clear and not ambiguous. Because you hear one thing. For example, let's talk about this closing of the school. The mayor is saying one thing, the governor is saying another thing. See, so we want to be clear so that there will be no ambiguity in the message. If we're staying home, do we qualify for unemployment? The hair braiding salons, the hair braiders, the barber shops, do they qualify for unemployment insurance? Those are some of the things that we need to know. And for the most part, we've been able to get that information, but getting it to the larger community has always been our challenge. And that's where we rely on people like you. We're hoping that the word will get out through you and through some of the other media personalities in the community.
Things are very, very, very difficult. So the past couple of days have been inundated on deaths in the community, the challenges that the community is facing in trying to get testing. I mean, everything, it's pretty chaotic at this particular moment. I mean, you can see what the city and state and then the federal government is dealing with. So you can imagine what that exactly on the local level, how challenging that it is. And those of us civic leaders trying to do a couple of things. One is to decimate the right information, because there's a lot of fake news and fake information and information that's going viral in the local community. So one of the things that I have been um, laser focused on, is to make sure that we dispel the rumors and the fake news, and that we provide as accurate information in terms of how to protect yourself against the virus, and how to access resources, and particularly for the businesses, how to go about partaking in the relief fund that's being made available. And I mean, there's just so many layers to it. And it's really making sure that we are providing the best and accurate information as quickly as is being available to us.
The city and state released data this week, and it shows that Black and brown people are the ones who are dying the most. So do you have an idea of maybe how many deaths we've recorded in the African immigrant community on the island?
I can tell you, as of the past couple of days that I know about right now, we have lost about 8 or 9 individuals in our community, and that's the ones that we know. Now, remember, this is shelter in place, which means that we're being mandated by government to stay in our homes. So there's a challenge with communication, because, traditionally, we Africans were accustomed to going over, which grandma is not answering their phone, or which parent is not picking up the phone. And typically what we do is we visit. That's what we're culturally accustomed to doing. So I know that the numbers unfortunately are rolling in. And later on, there's a couple of things I want to actually touch up on what's happening in the community, because there is a word getting around that some people There's conspiracy theory. People don't believe that there's actually a virus, which is very dangerous because that is also accelerating the death and the contagion and the contagiousness of the virus, which is a challenge that's not allowing us to know how bad things are. You understand?
Mm-hmm.
So in terms of, to answer your first question, as of right now, I would say about 9 individuals that I know. Yesterday, someone died from the Nigerian community. I got the information on that. Day before yesterday, the same thing. A Liberian, one of the Liberian local old leaders that I know that passed away.
I remember doing a story here in Harlem, beginning of March, and many people I spoke to would either tell me, well, this is a man-made virus. It's all about money. So they're going to come up with a cure and we're all going to have to take that shot. Or I was hearing, well, this is a white man's disease, so we're not affected. And have you seen any black person being getting the coronavirus? So I was hearing a lot, but
I heard that too in early March. That was going around, early March.
I think that the black community doesn't trust the government much, or doesn't trust the healthcare system much because of the history of this country. So that's the reason why when these crises come, people, instead of reacting right away and saying, well, taking things seriously, well, this is a serious virus, we have to pay attention, we have to do what we told to do, people were very nonchalant at the beginning. And I think that maybe that's the reason why now we're seeing this death toll in the Black and brown community, on top of what we already know, that, we don't really have access to healthcare. We have these chronic illnesses that, once you get the virus, it becomes more complicated. So I think it's a number of things that just make it more difficult for us as people of African descent to make it.
Even African Americans feel the same way. There's a couple of, to buttress what you said, remember that our head of state initially trivialized the virus, and that happened in a couple of ways. Initially, it was downplayed, and then second of all, it was labeled the Chinese virus, and in so doing, it made it seem like it was foreign to us, right? So that reinforced the notion that our people had that, well, it's not our thing. We, and that was dangerous. So that did not help in getting out, again, accurate information. On top of the fact that the feds and the state and city did not get in front of the situation. So remember this. So if the feds, the city, and the state did not get on top of this early enough, then our people, who unfortunately historically are always behind, whether it's resources or whether it's update or whether it's advocacy, whatever it is, and because you are fully aware of this, we are always last to be informed or to be in the know. So now the situation gets out of hand. I could remember a few days ago, I was having a conversation with an African American civic leader, and I was just saying to her, because I employ her every now at per diem, and I said, Ms. June, please make sure that you're using your mask when you go out. Be careful, be cautious. She was arguing with me, oh, Bobby, no, God is in control. It's going to be all right. And I said, Ms. June, people are dying. Yeah. And again, she was debating with me. To her, it was not real yet.
Yes.
And the same person who would inform me of an Alhaji, prominent Nigerian who owns a deli in Park Hill, which is Little Liberia, had passed away. The same person telling me, bringing me that news, was the same person doubting the fact that this is a real virus. It's a pandemic, which means that it's really taken a hold, city and state level. So I think that right now, because I don't want to belabor the issue, right now what we need to do is we need to educate our people how severe and how serious this matter is.
our our struggle is in two level, health and economics. Health is that we notice that some people are scared. They don't. It's not that they're scared of going to the hospital. It's like they're scared of getting sick, and also the care of the kids. And we noticed that's why we few people. And recently we started noticing that some people also are struggling to make end needs.
So when you say they are not scared to go to the hospital, does it mean that they have the symptoms, but they chose to stay home because if something happens to them, then there will be no one to take care of the children?
Right now, I think the problem is more mental than the disease itself.
Mhm.
People are so scared of the disease that any 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 single thing that happens to them, they think about it.
Okay.
So yeah, so when that happens, it's like then in those situations they call us, and what we advise is like when if you we have a list of the symptoms. If you feel and you either have to go to the hospital or call the ambulance, the emergency. And uh, apart from that, we have a group of nurses that in the community that you can call and listen. So many of them will end up not being like related to the COVID-19.
They pretty scared right now.
Yeah, it's the fear that really keep people like awake.
When you talk about the economics, you are saying that a lot of people are not able to make ends meet. Is it are they able to file for unemployment?
Our community is not really integrated into the system, and we're still working on that. And people, many people work, but are not really qualified for all those work. So, uh, but we encourage people to apply for the unemployment benefits, and we even like try to help those who have a problem to go through the process, and we also trying to see those who are not qualified for the unemployment, and and if as a community we can like come up with uh, an idea is like a solidarity fund or something like that. We'll try to at least even if it's a food pantry or something like that, to try to help people.
Have you recorded any death in the Burkinabe community?
No, in New York, we nobody reported us about any death.
Does it mean that the Burkinabe community is well aware on how to protect um, themselves from the virus? They know what they need to do, and they staying home?
Yeah, we put a lot of work into that to try to tell people what to do to prevent from the disease. And especially, we say the best way to not to get sick is to stay home. So we encourage people to stay home very early,
Mhm.
and with the closure of the state by the governor also helped. So, and we have many of our community that just stay confined.
So you spoke about two challenges: health. I would say mainly the fear that they're gonna contract the virus, and then there will be no one to take care of the children. The second is being able to sustain themselves during the crisis. Are there any other challenges or other things that you would like to share with us when it comes to the coronavirus crisis in the Burkinabe community?
What we'll do now probably is like to try to direct people through the mental health, because that's still I don't know if it's the right word, taboo in the African community. I don't know, you can get mentally sick and not be mad. So we will try to like inform people and like encourage people to take advantage of that service that the city is offering. And with the confinement, it's sure that people are getting stressed up and we irritated with the especially with the kids home and the homeschooling. Yeah, because that's also another problem, because as we know that some parents are at the level up to follow up the kids with the homeschooling, and also with nobody also can go there and help them with that. It's kind of difficult, so the child might be left with no continued education until everything is settled out.
So anything else you wanted to share?
I think our community is unknown to the city, not wanting to be known, made us like invisible in the city. And if we are able to work closely with the city to be able to enact plans that will help our community in the educational and economical ways, that would be helpful. We have many people who have very entrepreneurial, but the lack of information and resources makes it difficult. So if we can have help accessing certain resources, such as financial resources and even I'll say building resources, that can help boost the economical level of the community. I mean, the city itself would benefit from a boost of the Burkina Faso community, because I know the potential that is in this community. I know these people. I know what they can do. I just know that they are not put on their right place and not given the right tools. And also because they're kind of like hiding people, they don't go for that. And if the city can help us like access to those resources, it would be helpful.